So breast implant removal surgery, breast implant exchange surgery, there's different variations of that. Straightforward exchanges have minimal risk. I mean, you're generally just taking out an implant, putting a new one in. If we're removing the implant, the capsule that's around the implant, we will either remove or we will ablate, meaning we'll cauterize it and have it shrink back down. Sometimes you'll have a drain in there, so keep an eye on the drain. That should fill up over the course of several hours with like a punch colored or a tea colored fluid. A lot of times also we have to do a breast lift to lift the tissue back up. If we do that, you're gonna have a scar pattern that goes around the areola, or around the areola and down, or around the areola and down and across. But there is a risk if we do the implant exchange, we will have discussed whether we're going larger or smaller or the same size, but there is a risk that the size may still be too large or too small. If we're removing the implant, there's a risk that you may have very little breast tissue left, and you may need another procedure afterwards. And for all these procedures, there's a risk of scarring. The risk of scarring is 100%. You will have scars, and we will have you on a scar regimen afterwards to try and minimize the appearance of it.